Hello viewers, my name is Dr. Reem Khan and today we are going to discuss about in vitro fertilization, commonly known as IVF, which is type of one of the treatment options that is being provided for male infertility. And if you want to find out more information about male infertility, we have already discussed that in our previous videos. And if you have missed those videos, please click on the link provided. And also, if you would like to learn more about infertility, pregnancy and parenting, please subscribe to our channel. So in vitro fertilization, also known as IVF, is a type of fertility treatment where eggs are combined with sperms outside of the body in a lab. And this is a method used by people who need help achieving pregnancy. IVF involves many complex steps and is an effective form of assisted reproductive technology, which is also known as ART. So today in this video, we are going to discuss in detail what is IVF and why it is performed, how long is the IVF process from beginning till the end, how common is IVF, what is its success rate, what is the difference between IVF and IUI, and we will also discuss some of the procedure details in our next slides. IVF is a type of ART where sperm and an egg are fertilized outside of the human body. As we discussed, it is a complex process that involves retrieving eggs from the ovaries of the female partner and manually combining them with sperms in a lab for fertilization. Several days after fertilization, the fertilized egg, which is now called as the embryo, is placed in the female. Pregnancy occurs when this egg implants itself into the female. So now, why is IVF performed? People choose IVF for many reasons in infertility treatment, especially when one partner has an existing health condition. Some people will try IVF after other fertility treatment methods have failed, or if they are at an advanced maternal age. So IVF will be an option if one of the partner has blocked tubes or damaged fallopian tubes for the female partner, and if the male has low sperm count or other sperm impairments. And in other cases, when there is unexplained infertility, then even IVF is a very common option to be used. How long is the IVF process from the beginning to the end? It is a complicated process which has many steps. On average, a couple can expect the process to last from 1 month to 6 weeks, that is from 4 to 6 weeks, which includes the time before egg retrieval, like that they are going to take the egg from the female partner when a person takes fertility medication until they are tested for pregnancy, that they are then pregnant. Now, how common is IVF? Approximately 5% of couples with infertility will definitely try an IVF. More than 80 million babies have been born from IVF since 1978 when it was first introduced. And it's one of the most effective assisted reproductive technologies that are being available. And out of all couples that try for the IVF or that go for the IVF, the success rate is worldwide 24%. Like, if 100 people try for IVF, 24% will get a healthy baby at term at 36 weeks of pregnancy. Now we are going to quickly tell you all the steps that are being involved in IVF. First of all, they start with ovarian stimulation. After ovarian stimulation, good quality ovas, 3 to 4, are being taken from the female partner. And then there is the egg retrieval. That is, they take the eggs from the female partner, and then in a lab, in a dish, the sperms and the eggs and the ovas from the female partner are being united to form a fertilized embryo. And after that, we look for the embryo development. After the embryo has been developed, then the embryo is being transferred back into the female partner. And after that, we monitor for the pregnancy. So this was a general overview and some of the procedure details about the IVF. Definitely there are some risks and benefits, the recovery and the outlook of the pregnancy, which we will be discussing in our next video. Please stay tuned. And if you would like to learn more about infertility, IVF, pregnancy and parenting, please subscribe to our channel. Bye.